today we have plastic surgeon Dr. Jeremy White, who breaks down multiple facelift approaches and issues that you may be having and how to address them.
Hey, Susan, thanks so much for having me. It's going to be really fun.
I worked with an injectionist who was starting to inject my jowls, and I looked at her and I thought, your jowl, you're just very square. I'm not loving that look. So I just...
Yeah, I mean, and that's what most people pay me to get rid of, is that as they age, everything is coming down, so their jawline looks square. And so that's the whole thing that we're trying to reverse. So yes, it will look great on a profile. It'll look great on the side view when you inject this whole area and poof it out. But from the front, man, just doesn't look right.
Okay, so same question then for, the jowling. What can be done that's non-surgical, or when do you get pushed over to, no, this is requiring surgery?
Yeah, so for very, very minimal jowling, I will still use face type with Morpheus in the area. We're talking about small amounts on someone who's not ready for a surgery. I still prefer it in general in the neck, especially in someone who has a little bit of skin laxity and especially some fat in the area that I can remove. You can get a really beautiful, dramatic result. So I think that's still really the only other option for non-surgical, aside from hiding it with some filler as well. So the other thing that comes with that is the bargain hunting. And I understand everyone's got their own budget, right? And I think that with that I caution again, because this is your face. And yes, you don't necessarily have to have a $500,000 facelift. Like, you just don't. Not everyone can afford that. That's great. There are plenty of really, really excellent surgeons who can do a procedure that will get you an amazing result for $15,000 or $20,000 or whatever it is. Don't go looking for that $3,000 miracle facelift, because if it's that cheap, it's too good to be true. There's something else going on. So if it sounds too good to be true, it probably is.
Yeah, that's a lesson I keep learning over and over in my life. So, okay, I want to move up the face if we can. We talked about my crinkle area. We talked about the turkey neck and then the jowling. What if a patient comes in and they're really seeing kind of this cheek area hollowing out or falling?
I assess them for laxity. So I want to see, hey, if they see real rolls like this, then we start considering, like, listen, with real rolls, I can do something with filler often that will help to support the cheekbones and help to support the midface. You can do that with filler on your local, topical in the office, no big deal, right? Some people, my braver patients, they just use ice, and that's totally fine. There's fat grafting. Fat grafting is a much more long-lasting option. You're using your own tissues. And I combine that with most of my facelift surgeries. And I think people who get it, they get a really nice three-dimensional, beautiful rejuvenation result, because that's part of the issue, is that they've lost that volume. If they have a lot of sort of a deep roll here, and then we really got to talk about lifting and filling at the same time. So then we start talking about, adding surgery to sort of resuspend that area. And then still, I'm doing some fat grafting to that area, because there was clearly part of the issue was volume loss. And I think if you understand that, then one of the worst things that people are afraid of, I think, in plastic surgery is that they're afraid of looking fake or overpulled. And that's where a lot of the problems come in, is that they're not addressing the three-dimensionality. They're just really just trying to pull as much as possible. What pulling does alone is it's just going to create a flatness to the area. Yes, it will look tight, but it's going to be very flat. So you have to delicately balance between the lifting and resuspending, but also refilling to rejuvenate the area. And by the way, the fat grafting does a really beautiful job, not only of adding volume back into the face, but it's just something nice for the skin as well. I really think it helps the skin shine. There are growth factors in there as well. So it just turns a great result into an amazing result.
And just to be clear, fat grafting is different than PRP or PRF. These are two different things.
Yes. So fat grafting means I'm taking a little cannula. Often I'm taking a little bit of fat from the belly, small incision. I harvest it, I put it all in a centrifuge, and then concentrate that into small little syringes of your own fat. And I'll make 2 little puncture holes or wherever I'm treating, and then I'll place that fat into multiple different planes. And this is live tissue. So the point is that you can't just kind of plump it right in there. That stuff will die. So part of the technique is sort of like sprinkling little fat cells all over the area. And then you're allowing your surrounding blood vessels to feed it and to let it grow. So more of it will survive in the area. But the stuff that survives, that's yours. That's your own fat. So you're not going to reject it. And that will be with you hopefully for a long time. PRP, those types of things, great treatments, but they're going to do something very different. The concept there goes back to growth factors. I don't see it as something that's going to add volume. I think that's a misconception. There are when PRF was being talked about a lot, there are songs like PRF gel. I used it for a little bit. The concept again was, okay, well, you're going to help add volume, even more volume to the area too. And it's basically the gel is you're liquefying clot almost. I don't really think that that's going to add a significant amount of true volume to the area beyond that clot that then gets dissolved by your body and then goes away. So I never really saw it like that. I really kind of abandoned it pretty quickly. But PRF and PRP do something for the skin. There are some studies that have shown that can help some dark circles. It can help melasma even in some patients. Again, it's hard to promise anything with those types of treatments though, because this is taking something from your body, putting it back in there, and saying, "All right, work, do your thing." It's regenerative medicine is a totally different bag, which is kind of why I'm so passionate about surgery. Because with surgery, it's like, okay, I can take that, I can move it, I can put this here. It's true artistry there. With PRP, PRF, very cool. And by the way, patients love it. It's about finding the right technology or technique for the right patients. I find that one of the hottest things that we do is for that particular with PRF is injecting it underneath the eyes in this area. And that's for 2 reasons. One, patients, I can't explain it from a volume standpoint, but there is clearly some regenerative process that's going on to help you build some collagen in the area and just helps make the skin look a lot better because people notice, and it's not the patient necessarily just alone who's noticing, but their friends notice. And so then they send their friends and say, "Oh yeah, he's doing this." Is it going to be a life changer when someone has big bags underneath on their lids and a deep tear trough? No. I'm going to tell them this is not going to do that. It's for more subtle changes. So again, it comes down to you got to be honest though. What's it going to do? What's it not going to do? Same thing with exosomes. People are pushing exosomes, and what exosomes are these little packages of growth factors. They're within the cell, and they're saying, well, they're highly concentrated, so it should be even better. But I haven't really seen great studies to really prove that. So until I can really see that, why am I going to have people put in this extra expense in doing this when I haven't personally seen real long-term multiple patient data rather than cherry-picked patients? Oh yes, I injected this exosome in the guy's scalp and he grew hair. Well, what do I know about this patient? Why they have hair loss? How much? What else were they doing? What else was going on health-wise? There's so many other factors. So if you do a real study, say, hey, I'm taking 1,000 patients, and 500 of them are getting exosome treatment, and 500 of them are going to get saline. Let's see what happens. Okay, and make it something measurable. But don't give me this whole. Often what you get is a before photo with a totally different lighting, and after photo, all of a sudden it's totally different lighting, and the hair is dyed, and it's combed in a certain way, and everything looks better. So you have to have some standardization. You have to be honest, and unfortunately, a lot of the literature regarding the non-invasive stuff isn't always honest.
Wait, before we move up into that bag area and the eye area, now I've heard there's a certain type of filler that people are even saying might regrow bone. Is that a thing?
I'm not sure what you're referring to about regrowing bone. Radiesse can help build collagen if that's what you're thinking about. It's more of a bony type substance, calcium hydroxyapatite. So it's a bony type substance. I love using it. It's off the shelf, and it's great for creating strong jaw lines or very angular cheeks. Those are probably the two things that I personally prefer it for, but some people like using it for nasolabial folds and other areas too. And so that's really great. There's actually something called Renuva as well. Renuva is something that's relatively new, and it is, talking about regenerative medicine. This is basically like, how to describe it? There's something called a cellular dermal matrix. So ADMs, cellular dermal matrix, are sheets typically. And if you can imagine a sheet or an apartment building, and you've left all the steel beams, but I've taken out all the furniture. So that's what an ADM is. Now I just have the framework. And then the concept is that then now within this framework, your surrounding cells will come in, build a new home, and everything's cool. And now it becomes your own. So the concept with Renuva is it's a framework for fat. You inject it in the area, and your fat cells will grow in the area. Still somewhat new. People are starting to push this as a potential alternative to, fat transfer to, I've seen now people are starting to talk about fat transfer to the buttocks, fat transfer to the breasts with it. So it'll be interesting to see what happens as people kind of push the limits. I'm interested to see, truthfully, what it will do for the weight loss population, especially because in those patients, I found it a little bit more difficult to find enough fat for some of them to really get a meaningful volume change in their cheekbones, because they've lost it there, but they haven't just lost it here. They lost it in their abdomen and other places, and go searching for more fat. And you're like, gosh, I can't find anything. We can always use filler, but I'm going to, lift and see what I can find, use what we can find. Usually I don't need huge volumes in the face, but it's still something that I'm closely following, because I'd like to see how that really pans out before I just start to use it willy-nilly.
Okay, that's great to know. Yeah, I think standing in the grocery lines with my kids as they were growing up, I would kind of point out, do you see this person's pores? If you don't see their pores, maybe we should think about, how that photo was altered.
Right. Well, now with AI, you don't even know what to believe it anymore.
True. Very true.
Well, it wouldn't be something your esthetician would do, for sure. That like a dermatologist would do something like that, or a plastic surgeon who does phenol peels. Because again, that one's got to be done under anesthesia. But not everyone has to go through something so dramatic. You can do, even if you're just doing a peel, you can do a series of peel or a series of lasers and get really great results. Or you can do a fully ablative CO2 laser and like really get swollen and red and have the downtime for a week or two and then get a really great result like that too. So, lots of different ways to go about it. And by the way, it's the same thing in facelifting. In facelifting, just to kind of go back to that, we were talking about the chat groups and the deep plane facelift is the only way. Study after study after study has shown that that's not the case, that the longevity is the same, whether you do, depending on different techniques. We had twin studies that showed no difference in the longevity between two different techniques. And this was, again, by the masters. There was a recent review article that just came out in 2026, like 2-3 months ago, talking about same thing, a review of all the literature, and again showing, in the end of the day, it's not so much about what the technique was, but who's doing your surgery to get you that. So my next piece of advice to people is don't come in asking for a particular technique. You're coming in for that person's advice about how to address whatever it is that you want, or how to address your aging face. So listen to the advice, ask the questions by all means. I totally love patients who come in and they're educated about surgery, about non-invasive or minimally invasive procedures. That's all great. But in the end of the day, whether you do, we're going to say like deep plane would be sort of a medially based technique. Deep plane means that you're going, we'll kind of start from here. You have the skin and fat, and then you have this thing called the SMAS. And the SMAS is a little tissue that's underneath, and it actually extends down here into the neck, into the area called the platysma. Remember that little muscle we were talking about that does this? So it's all part of like the sort of continuous layer here. So that's what people keep arguing about is, oh, do you have to go underneath that layer, or do you have to, or is it going on top of it? The same. And again, people get into the echo chamber where they hear from a friend saying, oh, it has to be this, or they hear on Instagram, oh, this is the only way to do it. This is the best way to do it. Every study has shown that in the end of the day, it's about the surgeon and not about the technique. And if anything, deep plane facelifts show a 17% complication rate versus a 10% complication rate in traditional procedures. And especially when you resect submandibular glands, when you're removing parts of this tissue here to try and improve that contour even more, it's also another like 10% rate of facial nerve paralysis. Typically temporary. Most of them recover up to 3 months, but still it's something to go through. And if in the end of the day you can get the same results, excellent results with other techniques, it's a discussion, right? It shouldn't be come in, this is how I want my burger done, and have it your way. It's like, hey, I can make you a delicious burger. It's gonna look, it's gonna be amazing. I hate to compare it to Burger King. But you understand what I mean. That that it's an art form, and it helps to understand all the different techniques. I've done them all. I've done it in different ways. I will tailor my techniques to my patients to achieve the results that I need to achieve. I will treat patients with really, really thin tissues very differently than I'll treat someone who's younger and has thicker tissues. They all have pros and cons, and they all have risks and benefits. So my philosophy is I want to get amazing results, but I also want, in the end of the day, I want my patients to have an easy recovery. I don't want them to have to suffer. I don't want them to have to, be that next person on the chat asking, oh my God, my face is still paralyzed on one side. What's going to happen? It's a lot of stress to go through. And, you paid a lot of money to go through an aesthetic procedure to look better. So we want this to be a good, easy experience for you, and you're going to look amazing. That's what it comes down to, bottom line. But every study that's gone time and time again, even we're talking about in the most experienced hands in the world who are publishing some of this data, and it's time and time again, it's basically the longevity is the same. So it's like, well, why are you pushing it? Just go to an excellent surgeon, go to someone with whom you have a rapport, someone who's going to listen to you, someone who's going to help you through your process, because it's not always easy. And make sure that they're make sure that they're board certified in plastic surgery, but also that they're plastic surgeons who specialize in different areas. Someone who's doing 95% breast augmentation all day long. Facelifts aren't typically something you just dabble with. Certainly not rhinoplasty either. So that's the other thing. It's like, okay, well, what's your bread and butter? What's your typical thing that you do all day, and figuring that out to sort of hone in on your search. The other part is there are lots of really great surgeons all over the country, and sure all over the world. It's great to travel. We have plenty of patients who travel from all over, and I don't discourage that. But also I would just caution you about going internationally. There are a lot of people who are great internationally, some like world-class surgeons, right? But also there are a lot of people who are don't quite share the same ethics standards as we do in the U.S. And again, not all surgeons in the U.S. either, to be honest. But some things come to my mind, and I see a lot of very falsified before and afters. I just did recently. I was like, gosh, I saw something on social media, and it's just like it's hard to believe. It's just like it blows my mind. And I looked at the before picture and I looked at the after picture, like, gosh, if this is real, I am booking a flight to go there tomorrow. I want to learn from this guy because I'm amazed. And then I looked it up, and and then I looked up online, and it turned out there was this whole story about it. And turns out that the patient after the patient in the after photo actually kept getting bothered, kept saying, "Oh wow, it's your results are amazing," and he's like, "I never had surgery with this guy." So they took someone's completely different after photo or just his regular photo, and they juxtaposed it to someone's before photo, and they presented it as they're working. Like, it blows my mind. Things I would never have thought of before. So bottom line is, I think it helps to, think locally first. And it also helps if there's an issue, like sometimes things can go wrong. If there's an issue, you don't want to have to fly internationally to have it taken care of.
Thank you, beauty seekers, for being here with us today. Please subscribe if you're getting value out of this interview with Dr. White, and we welcome you to learn more on Beauty Seek.